Bismillah, walhamdulillah, wassalatu wassalamu ala rasulillah. Today in this video, we will learn about the top 10 mistakes that are usually done by students during writing a letter in OET writing subtest. So I am sharing these mistakes so that you can avoid these mistakes and you must avoid these mistakes in your exam as well. So let's get started and have a look on these mistakes first. So we have a file here, and as you can see, there is a bunch of information. So the first one is about the word patient or pronoun for the patient. Don't ever dare to use this word patient or use the word his, her, like these pronouns for the patient for the first time in the paragraph. These are considered very rude in official test, and also avoid these terms in your speaking subtest. It will help you to maintain your official go through. Instead of that, you must use his second name with Mr., Miss, or Mrs. Whatever the name of the patient, use his or her second name with Mr., Miss, or Mrs. That will be the most appropriate. The next mistake that are usually done by the student is here. Do not use the word disease. They actually uh, use the word mainly doctors are encountered by these conditions, and that's why the disease word is very common. But please don't use the word disease, and but use the word condition in place of that. It will help you to maintain your formal discussion and maintain your formal writing, and it will also consider rude if you use the word disease in front of the patient. Next word is the next important point is, do not hesitate to use the article. The article contains a, an, or the, and there is an evidence in OET exam. If you use them frequently, there is a chance of attaining highest score. If you don't use them, even then, um, they are more prone to the letters without these articles are more prone to have less score. So you don't need to hesitate to use the articles. The next point is about three important commas. Please note it down and make it very clear that these three commas, I have mentioned it here, are very crucial. You have to check them and also recheck them after you have completed your task of writing, that uh, and make it sure that you have put these three commas there, because these are evaluated separately for the marks in OET exam. The first one is after the name of the doctor, dear Dr. Stephen, with the uh, addressment addressing, and then the second one is between the patient's name and his date of birth, and the last one is yours after the yours sincerely uh, consultation or salutation. So these three commas are very important. Please make sure to add these commas whenever you write the letter. The next important point is S of sincerely is always small. Don't use the capital case for sincerely, like it's mentioned here. You have to write it in that style so that you can attain the maximum marks. The next point is male, female words do not give a good impression. Use the profession, or you can use man or woman instead. This is also important because, as you know, we doctors are much used to use a 14-year-old male or a 14-year-old female. Like these sentences are in our reflexes, but make sure if you are referring a letter or if you are writing a letter, that don't use male or female words, as these are not giving these are not the indication of good impression there. The next point is, do not use apostrophes in grammar syntax. I have mentioned do not. I am not using don't with apostrophe here to demonstrate you that this is also considered an informal way to write a letter. But your task is to write the letter in formal way. The formal way is to write the complete syntax like do not with space in between. So please make it sure that you have to write do not, would not, isn't, like these words in the full syntax. The next important point is capitalize the disease name which is named after a scientist. Only that important disease which is named after scientist should be capitalized, and the other diseases should be written with the small case. Okay, so like I have example of Huntington disease. It is named after scientist, so you have to write the capital H to start the Huntington. And in case of diabetes mellitus, you have to write the small d for diabetes and small m for mellitus. Uh, in case of the disease mentioning that. So that is the important point. You have to be clear about it. The next important point is capitalize the drug brand name only, not the generic name. It is also important to note that we are not used to stylize our writing in that manner, that we don't differentiate the brand name with the generic name. Always make sure that in your formal writing style or in your official exam, the drug name which is the brand name should be capitalized, and the generic name or the formula name or the classification name should be started with the small case. The next important point is use before in place of ago and on in place of upon. This is also important to mention here. After checking a bunch of letters, we came to the conclusion that students and the aspirants use uh, the phrase of 14 years ago, or yeah, they say they have that disease, particular disease, 10 years ago, 50 2 months ago. This ago is not appropriate here. You have to use before in that place, like 14 years before, like 10 months ago, 10 months before, like that, in place of ago. So before is more appropriate in formal way, in formal writing. And then we also came to the conclusion, the students ought to use upon investigation or upon examination or like these phrases frequently, but this is not considered good in OET official exam. You have to use on examination, on investigation, on lab test, like these. This on is more appropriate instead of upon. So I hope so. This will help you a lot in writing your letter, and this is actually the summary of whole thing that is highly paid off. And you have mostly students have to pay $1,000 for this little information, and at the end of even at the end of their preparation, they are not aware of these things. So I hope so. It will be very helpful. Make sure to share it with those who need it, and take care. We will meet in the next video. Thank you so much.